So first and foremost, question that's always been asked, okay? What is the current of injury? Okay? In a nutshell, the current of injury is what will tell you that there is an injury in the myocardial tissue. Okay? When we talk about current of injury, we're either talking about a positive current or a negative current. Positive currents will manifest themselves as ST segment elevations. And negative currents will express themselves as ST segment depressions. Okay? So, the current of injury, what we're talking about here is the flow. Okay? The flow of the current from a damage. Okay, the projectors. Okay. Is that okay with you guys? Okay. The flow current from damaged area to normal area of the heart between heartbeats. What happens here is the vector of the current of injury will point towards the normal part of the heart. In essence, what happens here is whenever heart muscle dies or is injured, its characteristics change. Therefore, it cannot depolarize and repolarize normally. Let me ask you, when you talk about dead tissue, dead cardiac tissue, will it depolarize still? No. Okay? Please note that in death, everything stops. So in the case of dead myocardial tissue, there will be no depolarization or repolarization. Okay? So what happens here? This, for example, you were driving down the road and the road was blocked. What would you do? You'll move around the blockage, right? So that's how the current works. If the road, for example, if the conduction system, if it passes through dead myocardial tissue, then the current will move around that dead tissue. Okay? However, if the dead tissue, some of it's still alive, what happens? Yes, the phenomenon of re-entry will happen, right? As I discussed in ventricular tachycardia. Okay? But if it's all dead, it just moves around it. Note that, as I mentioned, the pattern of repolarization will also be affected. Note that if depolarization is affected, repolarization will also be affected. And because the pattern of repolarization is affected, the morphology of your T wave will also be affected. So what are the causes of injury currents? Okay, so mechanical trauma, okay, mechanical trauma to the heart can also cause currents of injury. This will make the membrane permeable, so permeable that full repolarization cannot take place. What do you mean by so permeable? Remember that what's needed for repolarization to occur? Sodium. Depolarization, sodium. Repolarization? Yes, okay, the movement of potassium. So because it's so permeable, technically what happens is the characteristics of the movement of sodium and potassium also change. There's a great possibility that what happens with sodium is it stays. Therefore, as long as sodium stays, repolarization cannot occur. Infection. Infections like endocarditis and myocarditis, okay, infections of the myocardial tissue, these can also affect muscle membranes and cause currents of injury. But the most common cause, as we all know, is ischemia. When not enough nutrients from the coronary blood supply are available to the heart to maintain the normal membrane polarization. Now take note that insufficient blood flow to the heart, okay, will depress the metabolism of the muscle due to 3 reasons. Okay? The first reason is, number 1, lack of oxygen. So take note. One of the reasons why metabolism of the muscle will be depressed is because of lack of oxygen. The second reason is because of a lack of oxygen, there will be an excess accumulation of carbon dioxide. Do not look for it there. It's not written there. Okay, listen to what I'm saying. Okay? And the third is a lack of other nutrients. Okay, other nutrients. Sodium and all of these things. Consequently, what happens? Bless you. Repolarization of the muscle membrane cannot occur where there is severe myocardial ischemia. I'll tell you, let me ask you again. Is ischemia, do you think it's reversible? Is ischemia reversible? Yes, okay? If you return the blood supply to the heart, then the effects of the ischemia will actually disappear. Okay? With or without consequences. So talking about the current of injury, this is what we call the positive current of injury. The positive current of injury is always above the isoelectric line. Okay? The best way to look at this current of injury is you have to look at what's called the J point. What's the J point? The J point is the end point of the S wave that meets the isoelectric line. Why? You have to look at the J point because this will be reference whether the ST segment has actually risen or has dropped. Okay? I'll discuss later in the lecture. Okay? This is just to introduce you to it. So look at the J point, and there we have it. This is a negative current of injury where the ST segment is now lower than the isoelectric line. And later I will tell you what's the significance of these two. Now in terms of, this is in Guyton, okay? The current of injury in an acute anterior wall infarction. Note that there's intense injury potential in lead B2. Okay? Look at this. Lead 1. What do you notice about lead 1? Lead 1. There's a positive current, okay? Where's your J point? It's somewhere around here. Note that it is raised above the isoelectric line. Lead 2? No, it looks normal. Lead 3? Yeah, there's a depression. Why would there be a depression in 3?
Because the axis is opposite.
Okay. 95% correct, okay? Basically what happens is, because these two technically are inverse of each other. So if this is raised, this will be dropped, okay? So, good. Look at B2. Look at that. Okay, that's not an artifact. That's an actual phenomenon in MI. Hitesh, what's this phenomenon called? Anyone know what that phenomenon is called? Someone said it, yes? Abnormal one. Okay, please note this phenomenon is called pathologic Q wave. Q wave. Okay? Pathologic Q wave. The pathologic Q wave is there's what's called the physiologic Q wave, right? It's the first wave of the QRS complex. But later I will explain to you why a pathologic Q wave occurs in MI. Okay. So acute coronary syndrome or ACS. This technically the reason why there's CPR, advanced cardiac life support, basic life support is because of a condition called acute coronary syndrome. And this syndrome is a group of symptoms attributed to obstruction of the coronary arteries. What are the coronary arteries again? Blood supply to the heart. Excellent. Okay? The most common symptom is usually chest pain. What type of chest pain again? Crushing type. Okay?